Good morning, everyone. Thank you for joining us this morning. We have Melissa Howell with us this morning from Greene County Public Health. She is the Greene County Public Health Commissioner. So we want to thank her for taking her time this morning to join us. Before we go ahead and introduce her, a couple of housekeeping items. I have Alyssa Collier is in charge of our waiting room and everything this morning, and will be assisting with questions and everything. So if you have any technical difficulties or anything, please message her. Please be respectful and mute your microphone. All attendees should remain muted through the webinar. If you would like to see who is participating in the room, at the bottom of your screen, if you click participants, you can see who is in the room, as well as that's also where you'll find the chat button, and that will pop up on your screen as well. Due to the size of our group, we will proceed with doing questions through the chat portal, and I will then moderate and ask those questions when the time permits at the end of Melissa. So again, if you please keep your microphones muted, and at this time, I'm going to go ahead and introduce Melissa. We have Melissa Howell. She is the Greene County Public Health Commissioner and has been Health Commissioner for 17 years. She directs over 60 full-time public health professionals in daily operations, creates vision, and oversees the implementation and strategies used to improve the community health. The organization is a local health agency whose mission is to prevent disease, promote health in the community, and protect against disease threats in the environment. For the past 6 years, Howell has been working to moderate public health services, established a federal qualified healthcare center, accomplished national public health accreditation, and oversaw the construction of a new healthcare facility. At this time, I will go ahead and turn it over to you, Melissa.
All right, good morning, everyone. I thank you very much for having me again. Of course, today we're going to talk about COVID-19 and where we're at specifically in Greene County. I do want to go back and just review for everyone what health districts are. We were formed about 100 years ago under Chapter 37 of the Ohio Revised Code. We are an arm of state government. Lots of people think that we're a county agency. We're truly an arm of state government. But we were formed in response to the 1918 pandemic influenza at that time. So many villages, townships, and cities 100 years ago became overwhelmed with trying to respond to outbreaks of infectious disease. And of course, 100 years ago, we were much more used to hearing of outbreaks of infectious disease like scarlet fever or typhoid or cholera. But again, those officials came together and pooled money together to create these health districts so that they could have input from public health professionals. So our mission is to prevent disease, to promote health and wellness in Greene County, and then protect the quality of our environment. If you think about a school district, health districts are similar in that we have a geographical location, and our location is all of Greene County. And if you think about a school, the school has a school board that sets their policy and oversees what they do. We have a health district board, which is a 13-member board made up of residents from all across Greene County who oversee what we do. The thing that we're probably most well known for is infectious disease. Last year, we investigated 1,723 reports of disease. We also responded to a hepatitis A outbreak where we had several cases of hepatitis A, and in that case, you can go in and get vaccination, and we were able to bring that outbreak to resolution by February of 2019. We were also involved in tornado response last year, able to open all of the restaurants that could be open within a week. We do provide birth and death certificates. We study the leading causes of death. We pull together community members, and we look at all of the different health data that exists, whether it's morbidity, mortality, or natality. And then we prioritize health issues with other agencies, and together we work on things to improve the health in the community, things like opiates or falls in the elderly, obesity in our population. We also have programs that increase physical activity, programs for occupant protection, car seats. We have programs for children who have medical or developmental delays. We have the WIC program, home visiting. And then we have the environmental programs, which are things like food safety, sewage, water, pools, mosquitoes, rabies, tattoo operations. And then most importantly, again, is our work with the community that we do. So that's just a little bit about us. And now what I'll do is I'll update you on response and some of the current issues and future planning for us. You can go to the next slide. I will tell you that in Greene County, we are starting to stand down a lot of our operations, and I'll talk about that as we go through. Next slide. All right, so by now everyone should know what COVID-19 is. The World Health Organization was alerted to several cases of pneumonia in China, the Wuhan city, Hubei province of China, and they did implement mass quarantine at that time, but it was not really declared a global threat by the World Health Organization until January the 30th, when they noted that person-to-person transmission was occurring. And then on January the 31st is when the U.S. Department of Health and Human Services declared it a public health emergency in the United States. So COVID-19 has been characterized as a rapidly spreading respiratory illness that can cause severe illness and death in certain individuals. It has proven to be lethal to some senior adults and those who have underlying health conditions. So the initial concerns were that this has the potential to overwhelm the healthcare system, causing shortages in the supplies of personal protective equipment. And we have seen that occur in some places. Fortunately, in Ohio, that has not occurred. But our PPE is short at this time. As you've probably heard in the news, the Strategic National Stockpile has been depleted. Our local Strategic National Stockpile was depleted, as well as a regional medical response system stockpile was depleted. So the virus is spread by coughing and sneezing, and flip my notes around. There's still no cure for it, and there is no vaccine. Many times in the news, what we're hearing is things about this drug and that drug, and updates on testing and updates on vaccine development. And these are all pieces of information that come forward, and those pieces are more like pieces of a puzzle. And so each one gives us maybe a little bit more information about what's going on. But overall, this is a brand new virus, and so we are still learning about it as we go along. The testing, the vaccine, the drugs, they all take time to develop, and then they take testing to determine whether or not they are accurate or effective. So in Greene County, we've been using what's known as an area command structure, and this allowed us to use multiple agencies and multiple jurisdictions to manage the response to COVID-19. Overall, the purpose of the entire group is to ensure the health and safety of the people of Greene County, their families, our response partners, and the community. And so we have pre-established relationships with all of them. One of the primary things that we've been involved with, it's kind of more behind the scenes, but that we do pull down those resources for PPE, and then we're working with all police, fire, and EMS to make sure that all of their stocks are up to date and they've got all the supplies that they need, as well as the hospitals. You can go to the next slide. So the symptoms appear 2 to 14 days after exposure, and the symptoms are coughing and shortness of breath or difficulty breathing, or at least two of the following: fever. In our agency, we do record fever for our employees each day. Chills, repeated shaking with chills, muscle pain, headache, sore throat, and a new loss of taste or smell. Previously, the travel out of state was a consideration, and they just lifted that order yesterday, so that's no longer a consideration. And then whether or not somebody has been exposed to a COVID-19 patient or they're symptomatic themselves. And then as far as people returning to work, the guidance, even though the guidance is being updated as we speak, is that someone can come back to work after they have been fever and symptom-free for 72 hours without the use of medication. The symptoms have improved for 72 hours, and it's been at least 7 days from onset. That main message again, though, if you're sick, stay home, that still is in place. You can go to the next slide. So ODH, of course, is reporting the accumulative number of cases each day. In Greene County, as of Monday, we've had 64 confirmed and a probable 33. So I just want to give you a little bit of background about how some of this stuff works, because people will see these numbers and they think, well, we have more, we have more, we have more. And that's not necessarily true. So overall, we've had 256 reports and that's out of the 169,000 people or so in Greene County on any given day. So only 256 reports, with 97 of those cases being either a positive, meaning that they took an antiviral test and they are showing that they have a confirmed case, or the other 33 being probable. And so probables, what we're seeing right now is that our probables are going up exponentially, and this is because a lot of individuals are going out and getting the antibody tests done. So when someone has this disease, again, with that 2 to 14 day incubation period, let's say they got exposed 14 days ago, and today we get the report at the health department that they had tested positive. So 14 days ago, they may have been exposed. There is a time period where they may be asymptomatic. Sometimes they're asymptomatic throughout the course of the disease. But some individuals, maybe around day 11 into the course of this disease, they'll start to show symptoms, and they're coughing, they're sneezing, they having that fever, and then they decide, you know what, I think I better go get a test done. So another 2 days has gone by, and during that whole time period where they weren't necessarily having symptoms, and then those few early days where they are having symptoms, what CDC has said is that those people are potentially spreading virus, and actually they think that's where a lot of the spread is coming from. Very early on, CDC said, nope, we don't think you need the masks, and then now they've changed their mind, and it is because they realized that during that whole time period, people could be spreading this virus around. So even though it's only recommended for the larger population that you wear masks, and many of the businesses, of course, well, all of the businesses are saying, yes, the employees should be wearing the masks. And it is that idea that those individuals could be spreading virus around. And if you think about it, if you own a business, I mean, at the health district, we do this, we wear the masks in common areas where we're running into each other. You don't want your infrastructure to go down. You may have 1 or 2 employees that can only do a certain function in your business, and if you lose them, you lose everything. So people will sometimes ask me, well, do you think those masks work? Well, the cloth masks, what they will do is if you're that person who has been exposed and you're going around with kind of that pre-symptomatic time period where you're spreading it around, certainly it's going to cut down on the amount of viral droplets that are coming out of you. So yes, I think it's a good idea to wear the masks. Okay. Oh, I did want to say this too. So when we are coordinating these investigations, sometimes we'll get questions about Wright-Patterson Air Force Base. So Wright-Patterson, the Department of Defense, has a policy where they will not release their numbers on active military individuals. But if those individuals do live in Greene County, or if they lived in Montgomery County, then those numbers would be counted in our numbers. And really what we do is once we find out that we have a case, then we talk to them, we find out who they've been in close contact with, meaning they've had face-to-face contact for about 30 minutes within the last 14 days with someone, and that is who we define as the close contact. I will say this too, that when I first started in public health many, many years ago, disease reports, it would take them three or 4 months to come to public health. And now with this disease, initially we were getting the positive reports about 2 weeks after someone had tested positive. Now we're down closer to maybe a day or 2. But again, it's kind of like the late part of this, because the horse is already out of the barn, as they say. The person's already been spreading the virus around. So anybody who comes to us once we know that they're positive, they are safe at home. their contacts have been notified and they are safe at home. And so they're really not a threat to the public at that point in time. It was that previous time period where they are a threat. You can go to the next slide. So the information on the left is what came out from the Ohio Department of Health on Monday with 58 confirmed, 20 probables, the 12 hospitalizations. It was actually 5 deaths. That's a typo. Age range of 2 to 87 with an average age of 45. And again, just that focus on asymptomatic spreaders is what we're primarily seeing in our community. On the right-hand side is when you take those 97 reports, the 64 confirmed and now 33 probable, because both of these numbers have gone up somewhat. If you look at all of the ones in black, those are the confirmed cases. Those are your 64 spread out from either the date, there can be different dates. So it's either the date that they had the lab drawn, or it's the date that they were telling us that their symptoms, they had onset of symptoms. So, you know, when you're watching the news and the numbers go up and up and up, most of these individuals have been sick, and now they are no longer monitored by us in that. So some people want to say, well, how many have recovered? Well, we've had the 5 deaths. The rest of them, other than 13 of them who were confirmed, we only have 13 confirmed in all of Greene County. The rest of them are no longer monitored by us. But in the United States, we do not have a standard definition of recovery. And what we're seeing in some reports, some research studies are showing that these individuals have had more long-term effects. There may be heart effects or kidney effects. And so there's not a standard definition in the United States necessarily that says these people have fully recovered. And it hasn't fully been researched. So we just say in our numbers, they're no longer monitored. The gray ones are all of the probables, and most of them have had the antibody tests. And with the antibody tests, again, and we'll talk about this in the next slide, some of the ones more on the right-hand side, those are being listed by the date of report, meaning that's when we are getting the report in that somebody had an antibody test done. Then we go ahead and we reach out to those individuals and we say, okay, well, when were you sick? Most of the time what we're finding on the probables, where you kind of get that little jump on the right-hand side of that graph, they'll tell us, oh, well, I was sick back in March, or I was sick in April. So when we do call them, we'll probably find out that they were sick, and then those numbers will shift to the left in this graph a little bit. But overall, our numbers are low. Again, only 13 who are confirmed in the county as of today that we're looking at. You can go to the next slide. And this should be a map of the accumulation of where the confirmed and the probables have been. Sometimes people will ask us for zip codes, but again, the reports that come to us, those people are at home, so they're not a threat to the public. On the left-hand side, as of Monday of this week, are the 13 and the zip codes where they reside. So if you're looking kind of in that Beaver Creek area, 4440 has one. Looks like 431 has one. What's another one of your zip codes, Amanda? 434. Okay. So you can just kind of see there's probably 4 who are active and at home in that Beaver Creek area. Okay, next slide. We'll talk a little bit about the R0 and the RT, the rate of transmission. So in Ohio, we know that the rate of transmission has been 1 person to 1 person. And that's really good for us. In Greene County, the highest our number ever got was 1.6. And we find that in the rural areas of Ohio that the rates of disease are actually lower. A lot of this has to do with population density. In certain areas where you have more population, like Fairborn and Beaver Creek, you're probably going to see more disease. But if you compare that It takes a long time to kind of get settled on a final R0 for any disease. But if you look at some of the other ones, certainly this is not a disease that is as contagious as measles so far, but it will take time for them to decide on a final R0 overall for this particular disease. At one time they said it was a little higher than influenza spreading to 2 or 3 people. And right now our level of activity in all of Ohio is at 1. So that's a very good sign for all of Ohio. These are some of the measures that they're looking at for, well, how do we move forward? You can go to the next slide. Some of the most important numbers that actually tell you what's going on currently would be the number of new cases that come on each day and the number of hospitalizations. So we do pay a lot of attention to those numbers. The next slide is all about contact tracing, if you want to go to that one, to just explain a little bit about that. Oh, it's antibody testing, my bad. So for antibody testing, what's out there, we'll just mention that, so after a disease, you get 2 forms of immunity. The IgM is a short-term immunity, and then the IgG. So the tests that are out there right now are SARS-CoV-2 IgG testing specifically for this virus. Has not been FDA cleared or approved. So it hasn't been authorized by the FDA, but they do have the emergency use authorization from FDA to do that. The tests that we see locally are the Abbott tests. I'm not sure if it's I think it's called ID.me ones or not. I know that I saw a report yesterday that there was a problem with some of the Abbott tests, but the ones that we have from CompuNet and UD and Premier, it's my understanding that they are the Abbott tests. And with those tests, we look at the specificity and the sensitivity rate. So the specificity rate is 99.6% for those tests, meaning that if you go and get that test, 99.6% of the time, if it tells you it's a positive, is a true positive. And then 100% of the time, the sensitivity, if you end up with a negative, it is a true negative. But they are charging $65 is my understanding, unless you have a physician script with some of that. Okay, next slide. See if we get to what I thought we were going to talk about. Oh, contact tracing, yes. So again, contact tracing, this is something that we've done in public health forever, and it's just looking for, well, where is that first person? And then who have they been in contact with? And then those individuals get classified. If they were the first case, if they were control in a study or something like that. And then we look for clusters. So if there's a cluster at a store or a cluster at a manufacturing place, like or Dole, they're calling that a cluster, but yet they don't necessarily think that it originated there. So again, where we are looking for clusters to occur, where we have the most concern, of course, is in our nursing homes and long-term care, any congregate facility, and knock on wood, in I'm reading somebody's note here on the side. Yes, so knock on wood, we have not had any outbreaks in our nursing homes. Anytime somebody is coming down with a sniffle, whether it's a healthcare worker in a nursing home or if it's somebody in the nursing home, they call us, we get them tested. And fortunately, none of ours have been positive at this time. Okay, next slide. So a little bit on the timeline. We've talked about this before. When this novel coronavirus was announced, those Butler County cases being around February the 1st, we had our 100-year celebration. You can go to the next slide. This next slide is going to show you a lot of who our partners have been across the county, whether it's been DD, Family and Children First, Mental Health Recovery Board, police, fire, EMS, the faith-based, the K through 12. Our chambers have been great. So that just kind of lists out everyone there. But really down around the 7th and around the 9th of March is when we really say that that domino fell. Whether that was because Ohio declared the state of emergency or whether Ohio State had suspended those in-person classes, things really ramped up after that point in time. So you can go to the next slide. Around the 15th of March, that's when in-person dining closed, I believe. The restaurants and bars began to shut down. And that is where we saw Ohio really start to shift towards the enforcement of orders. You can go to the next slide. It was around March 21st to the 23rd. We had a lot of things going on with the stay-at-home order, which has now been lifted. We had our first case in Fairborn. And a lot of the measures that you see put in place are measures that have been used with previous pandemics. So I will say this about pandemics is they are disruptive in many different ways. They are disruptive to personal health, the loss of life, the severe illness, being on ventilators. They are disruptive to psychological health, individuals being shut up for many times, for long periods of times. Our nursing homes, they're experiencing isolation, even though I do know in some of the nursing homes, they're having some pretty swanky ice cream socials and some bingo parties. But, you know, that's a long period of time. It can be affecting psychological health. Others who have had previous issues with substance use. We've seen in Montgomery County where substance use overdoses are up. We have not had that issue in Greene County so far, which is a good thing. Socially, they're very disruptive. They have disrupted weddings, our funerals, our graduations, and economically, they are devastating. And then following kind of every pandemic, there's this time period of blame and finger pointing, and there's even some degree of civil unrest that can occur. We've seen huge populations in other counties, you know, pick up and migrate to other areas. These are all things that are characteristic of pandemics. And so we're not really surprised by what we are seeing going on. But I will tell you that some of the stuff that goes on, some of the political stuff that goes on, it has absolutely nothing to do with our response to the pandemic and what's going to go forward. So next slide. Okay, so we had our first death there on the 30th of March. I just wanted to show you on this slide that at the beginning of March, there were only 4 cases. Some had been hospitalized. We had some on ventilators at that point in time. So in our minds, it was either we had a more maybe severe form, there was greater viral load with these individuals. So it was a greater period of concern there at the end of March for us than it is today. Here at the end of April, we had 46 cases, 9 hospitalizations, and 4 deaths. You can go to the next slide. And then on May 1st is when the stay-at-home order became the Stay Safe Ohio order, and we were told, you know, don't get tied to that May 29th date. That has proven to be true. The health advisory was put into place on the 19th. Still recommending the 6 feet of social distancing, limiting of 10 people for mass gatherings, the frequent hand washing, and having sanitizing efforts in place. We did see the report from CDC that says maybe it's less likely that surfaces are responsible for transmission of the virus. So it does incorporate all of the previous business orders about social distancing. Considers the most vulnerable Ohioans as those who could suffer the most serious and adverse impacts from this virus. And then the staying home when possible, but it does lift the travel restrictions. And we can talk about that a little bit more, but what was happening was if you would go out of town and you were, say in Indiana on vacation or visiting family on like something, you'd have to come back and still quarantine for 14 days. That was really going to impact the business community because ultimately you were going to have to deny people vacation because otherwise they'd be gone on vacation, they'd come back, they'd still be out of work for another 14 days. So we were very pleased to see that restriction lifted. You can go to the next slide. So when they were developing Responsible Restart Ohio, they had several advisory groups put together. You can see them there on the left-hand side. Many of them have already issued their recommendation, and some of them are still working on the recommendation. We did see the court order yesterday or day before yesterday on the gyms. We've submitted that over to the prosecutor, who will ultimately decide whether or not that impacts Greene County. Some of the large venues, they continue to meet, but many areas are not open yet. We're trying very hard right now to get KillCare open, and some other areas where there's kind of a lack of guidance, so that's been one of our biggest challenges. We have been able to work, and I know Amanda might mention this in a minute, but with the chambers and through the chambers, as far as we would rather meet with a lot of our operators to get them the information that they need, to get them the clarification that they need, because we know as soon as an order comes out, people are picking up the phone and calling us and letting us know that most of the calls right now, we had 11 over the weekend. They've been masks and gloves in food service, and in some areas, those things are not necessarily required. So, our first option is to always educate people first, and that's the way that we would continue to move forward, even though we know that there are some other ideas going on, perhaps at the state level, for liquor licenses and things like that. So those things we'll have to work our way through. But again, we take all of those complaints seriously. But initially, our response is just make sure that our operators are educated. You can go to the next slide. So what will we do from here? Well, we will continue to focus on our mission and message. We are returning our own services to normal. We will continue to follow the cases and the contacts. We'll continue to distribute all of that PPE, getting people tested who need to be tested if they don't have any other option for testing. I think I saw a question pop in there about what was the testing over at Soin. That's the antiviral testing, so that will tell you if you're actually sick with the disease. Somebody from Soin or Greene might be on to say if they have the antibody testing, but as far as I know, it has just been CompuNet and UD and Premier doing that, I think. And then we're just working on this guidance with all of these different areas and trying to serve as a resource to bring up our community as fast as we can and as safely as we can. Again, with the 13 cases that we're aware of, we know that Greene County is ready to move forward. So it was very interesting that as all the orders were coming down, most places were saying we want it uniform, we want it uniform, we want it uniform. But then as we're opening up, because our rural areas are having less disease, people are saying, well, let's tailor it to local, let's tailor it to local, let's tailor it to local. So either way, we're committed to getting things open and going as quickly as we can. You can go to the last slide. I think it should be our last slide. Oh, I'm sorry. Nope, it's our protocols. So the ones that apply to all businesses are the COVID-19 responsible protocols with 3 guiding principles to protect health, support community efforts to control the spread, and lead responsibly in getting back to work. So those protocols specifically are the face coverings for the employees, the daily health assessments, the hand hygiene, the hand sanitizer, sanitizing and cleaning, and then limiting capacity as much as you can to allow for the 6 foot of distance and protecting those vulnerable populations. The last thing that's in there is, and this is what we tell everyone, is to plan for the what if you get your first positive. And if you do get that first positive, you can certainly call us at the health district. The number's there, 374-5600. We will help you to ensure that that person is getting monitored each day, because if their symptoms get worse, they could be hospitalized or something like that. And then we talk to that person and we just find out who their contacts are in case they were potentially exposed. And again, it's not just passing somebody in Walmart or Sam's or something like that, or Kroger's. It's 30 minutes of face-to-face contact within the last 14 days. And then we identify those individuals, and really what that's going to help us do is keep our numbers low. That's what we want to do, is keep these numbers low so that we can continue to take the steps that we need to take. I don't even like to say it's a new normal. We want to get back to where we were. We want to enjoy the things that we enjoyed previously. You can go to the last slide. Yes, that's the last one. So sometimes people will ask me, what's this virus going to do next? And I have to tell you, I don't know. Other coronaviruses, we know that by June 1st, most of them, their activity really decreases dramatically. I would love to see this coronavirus do this, but I don't know. And some people will say, well, we'll be back in the fall. Other coronaviruses will do that. That is possible. Just be prepared. Prepare your agencies, prepare your workplaces, and we're just going to keep moving forward. So that is all that I have to say.
All right, thank you, Melissa. Appreciate all of those updates and everything. A few questions that have come through. Have you seen a chart for Ohio and or federally that gives the statistics of general population less the congregate settings like nursing home and prisons? Is this something that we can get our hands on?
No, I have not. I have not.
Okay. You answered the question, I believe, on, as far as you know, Swain is not doing antibody testing.
Correct.
And on 327, the slide says the mass fatality plan was implemented. What is the relevance of that?
Well, again, we were really planning at that point in time for worst case scenario. So everyone writes, well, all the counties write mass fatality plans, so that if you saw something like in previous pandemics where people were not able to keep up with the number of bodies. I think in Detroit, we saw some, bodies being stored in hospital rooms and different things like that. So we implemented mass fatality plan in Greene County for the what if, and that would be like cold storage for bodies if it were to come true.
Okay. A dance studio, is it safe for kids ages 3 to 18 to wear masks while taking class and dance during their dance classes? Is this something that they should be recommending the students to do?
I would think that is potentially physical exertion that may not be a good idea. We could probably take that specific question back and see if there's guidance that exists on that. But again, I think anytime you have that level of physical exertion, it's probably not going to be a good idea. Now, the good news is that kids are really only responsible for about 1% of the overall number of cases. And some of the studies I've seen is that even though initially they were thought the ones to be the spreaders, they really would have only accounted for like 2 to 4% of the overall number of diseases. So we'll have to look at that a little bit further, I think, but I can take that back and get Sydney's information if you want.
Yeah, I can get her contact information to you and connect you guys. Another question, it appears as though the state is pushing decisions on reopening schools in the fall to the local health and school officials. Any thoughts on how Greene County may handle this in light of a very small number of confirmed cases among the children in our area?
Mm-hmm. We believe they will be open. I just saw the CDC guidance came out yesterday too, or updated guidance, I would say, on how to open the schools. And a lot of it is risk-based and a lot of it is based on the amount of disease that is circulating in your local community. So we'll have to kind of sift through that and again, work with the schools, the Career Center, and be available to update our community on how much is circulating then within our community so that they would know whether or not they needed to be open on a particular day or closed on a particular day. But overall, we want the schools open. We think it's more beneficial for the children to be in school than it is for them to be out of school.
I think there's many of us that can agree to that.
I don't have kids at home, but
I can send mine over. Is there specific signs that are schools can use to post when they do get open?
Yes, so, contacting Rick back at the health district, and Lori puts a lot of that stuff together. We pull it down from CDC or from the state. And I think Rick was going to meet with a lot of the chambers in the next week or so to make sure that they do have the signage that they would need, whether it's hand washing or just reminding people to stay apart, that kind of stuff. So yeah, there is signs out there.
Okay. How long does it take to get results from the antibody test?
Ooh, that's a good question. That's one I don't know.
I actually have that answer.
Okay.
Some
of you know more than I
do. No, it's all just by experience. It's about 3 to 4 days, business days is what, I would say maybe 2 to 4 business days is what they're saying at this time.
Good.
Is the antibody test, had the test done, it was negative. Is that good or bad?
The antibody test, if it's negative, that's a good thing, in my opinion, because you didn't have this illness and you couldn't have spread it. You couldn't have spread the illness anywhere. But again, that's also going to tell you that it's a good idea to take those precautions. The thing about the immunity that they don't know is it lifelong immunity? Is it temporary immunity? And so, again, just showing that you have that IgG doesn't necessarily mean that you won't get it again. I think China is having people who have tested positive previously are now testing positive again several months later. We know that this is a disease. People have talked about symptoms. We've seen it in Greene County 3 and 4 weeks where they're symptomatic. Other places have talked about months. They have felt the tiredness and symptoms. So it's just too new. So that's how I feel about that. Others might feel differently though. You can all have an opinion and that's okay with us.
Makes sense. Are there any estimates on the number of people who had the disease but never showed signs or got the test?
No, not yet. Not yet. Not that I've seen, at least.
Okay. And it looks like Judy did provide an update there. I think it just depends on what their numbers are at testing at the time, but she said she received results in 12 hours. So I think it just depends on what their quantity is at the time. Sorry, I'm reading questions here.
It's okay.
Are there other questions? And just a little bit, I will talk about an event we have upcoming with Rich. For those of you who asked those questions about some additional information, but we are holding an event next Wednesday, the 27th, with Rich Sherbaum and actually the Beaver Creek Township Fire Department fire marshal, and they will be providing a little more dialed in. Melissa definitely has kind of that broad piece, and they're doing a little more of that dialed in, specific to food service, but also that opportunity for you to ask questions a little deeper on the openings of different things and what signs you could use. So we do encourage you, those of you who have some of those additional questions, to attend that event. That is 9 a.m. on the 27th. It is on our calendar to attend. I don't believe there are any other questions at this time. Melissa, I want to thank you again for your time. The information is extremely valuable to all of our members. We really appreciate you continuing to work with us closely, give these updates, get us the information, any information that comes from you guys. We are pushing to our COVID-19 resources webpage on our website. So we want to encourage our members to check that out, make sure that you can get the information that you need. If there are other questions that you have, please do not hesitate to contact the chamber. as we can help connect you with either Melissa or Rich or whoever it may be to get some of those specific questions answered. That's really what we want to be here as a service for to you guys, is connecting you with those community members. So I mentioned the COVID-19 Q&A for food service and more on Wednesday the 27th from 9 to 10. Registration's on the website. And then we also on Thursday the 28th have a little more fun involved one. We are doing Cooking with Casa Nunez Thursday the 28th from 4 to 5:30 p.m. and registration is on our website. So if there are no other questions, I believe we are good. Melissa, again, thank you for your time.
Thank you, Amanda.
Yes.
You guys
Hello.
have a great day.
Melissa, hello, I have a question,
Yes.
Mrs. Melissa. May
Yes.
I?
Yes.
Okay.
Yeah.
My name is Tatiana Children, and I'm owner of 2 home care agency in Beaver Creek. We just moved last year after tornado. Gonna be 1 year Monday on this holiday. We were hit by tornado in Dayton, and we moved to Beaver Creek. We are close to Amanda building, and I need PPE for my nurses. Where can do you have idea where I can get it right now in this situation?
Yes, right now we have a lot of PPE at the health district and it keeps coming. But you would want to email resources at G for Greene, C for county, P for public, and H for health.info. So it's resources at gcph.info. The only thing we really don't have are gowns.
Only gowns?
I said that's really the only thing we don't have right now are gowns. We do have a lot of the masks and gloves and
Okay. Okay, I can order, but this I have to pay, or is free? How is it?
it's free.
It's
It's
free.
free. Mm-hmm.
Okay. Okay, and one more question. How is public health doing right now with kindergarten? Also, I have 2 grandchildren, and I'm very concerned about the kindergarten.
Mm-hmm.
Especially how they're gonna do. They're gonna sleep in a bed afternoon with shoes, like always. They have
to see the smaller children. Of course, that whole idea of social distancing is probably not going to happen. CDC had guidance that came out yesterday, and it is a lot what we thought. So we have to increase other things like the hand hygiene. I don't think you're going to get kindergartners to wear masks necessarily, but again, at the rate at which that virus is spreading within children, only 1% of the cases are children, and then overall, they've really only accounted for maybe 2 to 4% of the overall disease rate. So we'll just have to work through some of that guidance and see what's going to work and what's not going to work. Whether it be kind of cohorting of children, maybe that's easier with the younger groups than it is the older groups, and it's going to be kind of a school by school decision. And it's also going to be based on, well, how much disease is there in a community.
No, my question was specifically about shoes. I'm from Czechoslovakia, before Slovak Republic. I never see in Europe in kindergarten kids sleeping with shoes. We always have different shoes. We have to change to pajamas, go to bed like normal person. I never see this kid who came especially right now, have to wash hands and go sleep with shoes and came from outside. This is not logic for me, is not healthy. I don't understand this rule. This is some USA rules or Ohio rules or what? Can you explain to me what is that? Because I'm so upset about this. This is not normal.
I have not seen any guidance where they have to remove shoes. I have seen some studies that show that the virus can be on shoes, and people are wearing shoe covers in certain areas, but I would have to go back and look again to see if there's anything specific on not wearing shoes while kindergartners are sleeping. I haven't seen it, and maybe somebody else in the audience has looked into it.
Okay.
All right. Thank you, Melissa. We appreciate it.
Last question.
Thank you.
Yep.
Hold on.
Hello?
Go ahead.
Yeah, is any guidance or anything going on with school graduations, or has everything been canceled, or what do you know?
No, we've worked with all of the districts to hold their graduations. They've done it in different ways. Some have actually done it on the stages. Some have done, trying to think of what all we have done, but no, all of the graduations have taken or are going to be taking place.
Okay.
They submitted their plans to us. We reviewed them to make sure that distancing was there and masking and all of that. And all the plans met the guidance that's required. So they were able to do that. I think Yellow Springs is going to do a big parade through town and different things. So.
Okay.
All right. Thank you.
Thank you. Have a good day, everybody.
Hang in
Thank
there.
you for doing
Thank
this. Thank you.
Thanks, Melissa. We appreciate you. Have a great day, everyone.
Thank you. Thanks for having us, Amanda.
Yep, thank you.
Thanks, Dave. Thanks for the information, too.
Thank you.
Absolutely.
Have a great day.
You too.